listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in. Hello. And it is your favorite host, Zakiya Bell Rogers, and this is Tapped In. And then your other favorite host,
Leonard Jones.
And Leonard and I come to you from the Communications and Public Engagement Department of Buncombe County. Who do we have today, Leonard?
Today we'd like to introduce our special guest, Billie Breeden, Buncombe County's Age-Friendly Coordinator, and Brea Kuykendall. Brea Kuykendall, we're Agent Program Specialist, Health Promotions and Disease Prevention with Linda Sky. Welcome.
Thank you.
All right, tell us a little bit about yourself. We're going to let you go first, Billie.
I'm the new age-friendly coordinator for Buncombe County, and I just started about 3 weeks ago, and my job is to guide and support the activities related to age-friendly Buncombe County, and the main goal of age-friendly Buncombe County is to ensure that older adults are safe, well, and engaged. And this is based on the Age-Friendly Action Plan, and it aligns with Buncombe County's 2025 strategic plan with the two focus areas of resident well-being and an engaged and capable community by supporting residents' abilities to age in place.
Okay. And age in place means what? So that people know what that means.
Age in place is the ability for someone to live where they choose to live and maintain like some level of independence instead of going to long-term care facilities.
Okay.
That they can choose to stay in their home with the right supports.
Yeah, that's important. All right, Brea, tell us a little bit what you do.
Thank you for having me. My name is Brea Kirkvalle, and I am the Aging Program Specialist with the Land of Sky Regional Council Area Agency on Aging, focusing on health promotion and disease prevention. And what that does, primary focus of that is delivering evidence-based health programs to the area to help improve balance and prevent falls for our Western North Carolina adults. I also serve as on the Western North Carolina Falls Prevention Coalition. I'm an executive council liaison to North Carolina, as well as an advisor for Buncombe County and current chair for the Education Committee. So really out there trying to help people prevent falls.
So what is an elder? You know, I hear it being defined so many different ways. What is an elder and how is it defined?
Well, you know, elders, adults, seniors, all these are words we hear to define older folks or folks of a certain age. However, that question is often challenging because different agencies, groups, government has different definitions for that. For us at the AAA, at the Area Agency on Aging, a lot of that's based on the Older Americans Act. And so that's going to be folks that are 60 and above. And I know that the Buncombe County Council on Aging also focuses on 60 and above. But I do want to be careful and invite everybody, if you haven't hit 60, but you're interested in something, go ahead and contact us because we can get you on a wait list for when that big birthday comes, or we can reach out and help with other resources that may be more suited for folks.
And Brea's right that most of the agencies around here define an older adult as 60 and older, but Habitat for Humanity defines an older adult as 55 and plus, and Mountain Housing Opportunities, they also help older adults and they define it as 62 plus. So, but mainly people define older adults in our region as 60 plus, like the agencies that are serving older adults.
And so, Billy, I heard that you say you're new to the county, but as we're talking about our older residents of Buncombe County, what are some of the services that Buncombe County have for our older residents?
Well, I'm not new to the county, I'm just new to this position. So I've worked in direct service of older adults for probably 10 years, so I'm very familiar with some of the services. Like off the top of my head, I worked for Council on Aging for probably over 6 years. So Council on Aging provides a lot of services to older adults. They have a congregate nutrition program where there's 4 dining sites located around the county.
Mm-hmm.
They have an in-home aid program. They do help people with their Medicare. They also help people with the Affordable Care Act insurance, and those are for people, that's the one service that's below 60.
Okay.
They also provide caregiver support and benefits enrollment. There's other organizations like Meals on Wheels does homebound food delivery for people that are 60 plus and aren't able to cook. There's Jewish Family Services. They have an elder club as well as caregiver respite. And they also provide mental health services. Mountain Care is an adult day health program and an adult day program where older adults can go for the day and participate in activities and have meals, and it provides support to the caregiver, so they do a lot of caregiver respite as well. Piscal Legal Services provides legal advice. There's On Track that provides financial counseling. Mayheck provides home-based primary care. Like Habitat for Humanity helps with like home ownership and home repairs. Mountain Housing helps with home repairs. Transportation, Mountain Mobility helps with medical transportation and general transportation. And Council on Aging also has a transportation program, Call a Ride. So those are some of the services. There's a lot of services
Brea,
for older adults in Buncombe County.
Yeah, Billy, it sounds like you have a lot of wealth of knowledge. So with the position that you're in, so you said you're new into the position. So how can people connect with you in terms of tapping into some of that wealth of knowledge that you just shared with us?
Well, they could email me at BillieBreeden@buncombecounty.org. But they could also get involved in some of the work groups, because we have like over 80 nonprofit businesses, governmental departments, even older adults that are working in different work groups to make Buncombe County age friendly.
Okay.
So I could name some of the work groups if you'd like.
We'll get to that a little bit later. So we have a question around that. So, Brea, you work a lot with just direct services as well. What are some big things that you all are doing right about now?
As far as
Land of Sky.
Yeah, well, we have our ombudsman program, we have our foster grandparent program, of course. I've got to toot my own horn and say we've got the evidence-based health promotion that's ongoing, helping to improve that balance. We are constantly busy. I feel bad. I know I'm leaving folks out, and their work is just so important for the area. One of the big things we have coming up this Friday is actually our Falls Prevention Conference. We'll be doing that. We work with area partners, any opportunity that we can. From Blue Ridge Pride, Buncombe County, North Carolina Center for Health and Wellness. So we are out in that community trying to help. And our region goes beyond Buncombe County. It is Hendersonville, Transylvania County,
Oh,
and Madison
wow.
County as well for our area agency on aging.
Mhm.
So just following up, I heard that you mentioned fall prevention. Can you share a little bit more with the listeners today? What exactly that encompass? And you said you have a conference coming up. How can people participate in that process?
Well, our registration did close September 2nd, but
wow.
I know, right? But we do have it annually, so if you missed out this year, we encourage you to get on board next year. But there's a lot of stuff this month going around about fall prevention awareness, and it's really important because bathrooms especially can be a really dangerous place for folks. Flip-flops, throw rugs, they are what they say they are, especially as you get older. You know, folks in the bathroom are twice as likely to fall and have that result in an injury, and other than anywhere else in the home. And 1 in 3 adults over the age of 65 will have a fall this year.
Oh, wow.
And yeah, and less than half of those folks actually report those falls to the doctor. But unfortunately, the impact of a fall can create additional injuries and concerns on down the road. So that's why it's really important.
I would be fearful if they fell and like they hit their head or something and didn't report, because like often head injuries and brain injuries go undiagnosed because they don't report the fall.
Correct. And in 2020, there were actually 183,339 unintentional falls that were sent to an emergency department. So those numbers are really striking for North Carolina, and especially
That's
in
just
Western,
for North Carolina?
Yeah, and especially in Western North Carolina. We have a very high fall rate. Rural communities, things like that. We have a very high fall rate. So we're trying to get those numbers down.
And Buncombe County and Henderson County are 2 of the highest counties with the biggest fall rate.
Really?
Right here.
Yes, absolutely.
And I was looking at some data from the Western North Carolina Fall Prevention, and they had data from 2018, and there were 50 deaths in Buncombe County and 45 deaths in Henderson County, and the rest of the counties had lower levels. So I've been trained like to do a matter of balance program, and when I was doing that program back then, they really specified that Buncombe and Henderson have the highest incidence of deaths related to falls.
Well, if you hear those numbers, you think it's 52 weeks in a year. That's like 1 a week.
Wow.
As a matter of fact, falls are actually the leading cause of traumatic brain injury. And while not every fall results in this, 1 in 5 will. And each week, falls account for 1,189 ER visits, 266 hospitalizations, and 17 unintended deaths nationally. So it's very impactful on their loved ones.
Wow, those are shocking numbers to even just think about. So what are some of the preventative ways that people can help around just kind of preparing just the environment, their homes around to prevent falls? Do you have any suggestions around that?
Yeah, I think one of the first things we do is we approach how we look at our homes a little differently. So a basic, simple example might be when we're young, we put those blenders and different heavier dishes, things we don't use very often. We might put those in the top cabinets, get them out of the way. I don't want to see those except for Christmas or whatever holiday, right? Or you reach for that blender in a high place. Well, now as we get older, we might want to look at those high shelves and bring those things down, you know? Home modifications that might increase the size of the door. What shoes we're putting on our feet. Maybe slides are no longer the thing when we get older.
Slides are dangerous for you at any age. I've seen kids get taken out. So.
I can't disagree with you. Throw rugs, there's pretty rugs in our kitchen. We love them. They're aesthetically beautiful. But there comes a point where they can be dangerous.
Well, even the rugs in the bathroom, you look at them and sometimes they don't have that stickiness on the bottom. And then they have these new ones where they're wood. And that one kind of scares me as a person who has a broken eardrum, that like my balance is already off. And so I had to do a lot of classes to get my balance together. And that feels kind of unsafe to me. So let's talk about those bath mats. Like, what is the best type of bath mat to have?
You definitely, if you're going to choose to use a bath mat, I would definitely use a rubber back bath mat. Wood on wood, wood on tile. I would not recommend that. Grab bars. Having a place like getting in and out of the shower, I would strongly encourage having grab bars or some way to remain stable in the bathroom. But you just really have to be careful of those mats. If they're not going to stay in place, then you may be best not to have that mat if that's what it comes down to, because they will toss you.
Yeah, I've even seen some made out of like moss, and I'm always like, what bug is gonna come in? And I have a bug in my foot. So that's like a whole different level of elderly care. Like, no, we're not doing that as well. And then you see the ones with pebbles. I mean, the idea is beautiful, but it's not safe. And we want people of all ages, especially our aging population, to be safe, because we need you here. You know, we need your wisdom. And let's talk about some other ways to stay safe. You said grab bars. Also, let's talk about the bed. How many times people fall out of their bed? Beds being too high. For some reason, we all like to jump in the bed like we're the Princess Bride and dangle our feet off the end. But let's talk about the dangers of that. Either one of you all.
Well, yeah, I mean, too high a bed is not good, but also a lot of older adults, they have things like their nightstand is too far away, so they reach and then they fall out of bed, or some of them even have some of the, like those little throw rugs that should be out of the house, or even like clutter. They might leave like something by the side of the bed, clutter. I mean, that's one of the biggest things for not only the bedroom but the whole house. Get rid of the clutter, so, and you know, like books or papers or whatever, or like you throw a piece of clothing down, or even like dog toys, things like that. But do you have any ideas for the bedroom?
Yeah, another thought I would have is getting in and out of the bed. You know, we want to make sure that the bed, like you said, is not so high that folks can't properly stand up and have their full balance when they're getting out of the bed, rather than swinging the feet over and kind of making a small hop for it. That's not exactly our safest scenario. Keeping our linens and sheets, if you are making that bed, up off the floor so you don't accidentally trip on that, and really just be generally aware of those surroundings.
Well, you know, bed sets come with such fluffy stuff. The bed skirt that hangs all the way down to the floor, that can get caught on feet, and those fluffy pillows, you throw them off the bed at night, you get out the bed, you're on the floor with those pillows now. I mean, there's just so many different things. I think also people don't understand closets as well. Going into your closet can be very dangerous as you get older. It can be dangerous now, especially if you have shoes stacked up to the ceiling in boxes. They can fall on you. So what are some places, like are there any places that will help our this population declutter or things of that nature?
Decluttering, I don't know off of hand in agency. Now, we do have folks that are out there that are really great helping with repair. The Council on Aging on Buncombe County is a really, really great source. They have a minor repair program that's available. North Carolina Division for Independent Living can come in and do some accessibility modifications if that's the case, because you know we got to get in the house to begin with, you know, and that's something that might be overlooked, is broken stairs or stairs with no hand railings as we enter the home. So they can help with that. As Billie mentioned, Mountain Housing Opportunities, North Carolina Baptist Aging Ministry is a wonderful resources when it comes to that. And then Smoky Mountain Home Inspections, they'll actually do an inspection of your home, see if everything's where it needs to be and up to par, and in an effort to help folks age in place, to be able to stay in their homes if their homes are a good fit for them. We want folks to have that independence that comes with aging in place. And then if you, again, some minor repairs, because sometimes we might have a creaky board somewhere, that little threshold we're tripping over to get to the bedroom. And the United States Department of Agriculture offers low interest home repairs as well.
Okay. So in these places, we'll put like bars up if they like need them and everything.
Yeah, Council on Aging has their minor home repair program is installs grab bars like in the shower and next to the shower or by the toilet, and they also install handrails, and which is a big thing that older adults should have in their homes, like around
Even just hallways, right?
Hallways
Yeah.
and staircases, and so they do that as well as just minor things to keep people safe. And as far as like when you start out decluttering, that's I would encourage people to call the Council on Aging because they have like a resource. They like services coordinators that might be able to get people connected to different resources. Now, when I worked there, decluttering was a hard thing to find someone to do, but it might have changed. I just left in October, but it might have changed. And even like comes to mind the North Carolina Baptist Aging Ministry, you know, they might help with decluttering, but I would encourage people to call the Council on Aging first.
And I'll take a real quick opportunity to let folks know that the Lambesky Area Agency on Aging, as well as the Buncombe County Council on Aging, both have wonderful resource guidebooks that have websites, telephone numbers. They break all these services down, be it falls or in-home aid or nutrition, wealth of information in those. So you can also request one of those for more information.
Yeah.
So for a lot of our listeners today may be hearing of these agencies and the services they provide, but we realize that our Asian community often struggle with limited income. So when we hear about home repairs and adding things to your house, that can be a additional stress and burden. Are y'all aware, just from y'all work experience in the field, especially with our Asian residents, what opportunities this kind of financially can help people? So even though they may see they have an issue or a challenge that they want to address, are y'all, just for our listeners today, so y'all know where they can go to see if there's potential financial assistance to help with those?
Yes, the United States Department of Agriculture might be a good start. We can also work to get you with the Council on Aging, who can partner folks that are low income. All of our evidence-based health programs where we can work on our own wellness and our own balance, those are free. The ones that are offered by the Area Agency on Aging are free. They're funded by the Older Americans Act, so that's always fun.
Yeah, so the Council on Aging works with many different partners. Their services are free. They're funded by the Home and Community Care Block Grant, but they with their minor home repair program, there's no cost. They may ask for a donation, but there's no cost. But they partner with Habitat for Humanity and Mountain Housing Opportunities to do home repairs. And those two organizations, they do have, you have to qualify some, but it is for lower income people, so they can qualify for those programs. And I don't think there's a charge for them, but you could call the Council on Aging and get hooked up with the those two organizations. There's also Community Action Organization, which provides weatherization for people's homes, and Council on Aging works with them, and a lot of times older adults, they need help filling out the application. So that's the good thing about Council on Aging, is that they provide assistance and the middle person and help the older adults fill out the application.
Yeah.
So I hear you talking about the Council on Aging. Just for the listeners here, what exactly is the Council on Aging? Is it housed? Where is it housed? Or how they contact that information? Do you have that information?
Yeah, so it's It's Council on Aging is located off Hendersonville Road in the Deerfield Retirement Community. It's 46 Sheffield Circle. The phone number is 828-277-8288, and if listeners call there, they're a wealth of information.
I bet so. I think a lot of times we hear all these agencies and we don't feel like we're eligible for those programs. So I would just encourage anyone who is at the tender age of 55 and up to go ahead and, if you have any questions, call, get the information, and just see what's available out there, because you don't know if you don't ask.
Right.
Yeah. So, Brea, you all have some stuff coming up. You want to talk about that?
Yeah, so the Western North Carolina Falls Prevention, and if I could just indulge, is actually 14 counties. It represents 14 counties in the western part of the state: Buncombe, Cherokee, Clay, Graham, Haywood, Henderson, Jackson, Macon, Madison, McDowell, Polk, Rutherford, Swain, and Transylvania. So that's a lot of counties. It's west.
Yes.
And since 2009, we've basically been assisting the population of Western North Carolina in reducing their number of falls. And in September, we have a large focus on falls as it is, and getting the word out, like I said, with the MAHEC conference, partnering with them to bring educational opportunities, and we'll be doing that on the 9th. We'll be covering everything from community connections for falls prevention, home safety, which we've been discussing today, dementia and falls, as well as low vision, and incorporating fall prevention into Tai Chi principles. So
Oh, wow.
those will be some of the topics we'll be covering on Friday. Very exciting.
Well, we only have a few minutes left. I'm gonna give you, everybody time to say something to close. You have anything you want to add, Billie?
Not off the top of my head.
Okay. But if you think of anything while Brea and Lara are speaking, you're more than welcome to chime in. Brea, you have anything you want to leave with?
I want to thank you for having me today, and I would encourage anybody that is interested in joining one of our fall prevention coalition meetings. You can come join us on October 14th from 9 to 10:30. It is virtual, so you can do it from the comfort of your home. If you're interested in that, you can reach out to me at brea@landofsky.org. That's BREA at landofsky.org. I'd be happy to help you out with that or anything else you may be interested in. And again, I appreciate y'all's time today.
Yeah. Linda, you have anything you want to add or ask?
Well, just for the listeners, I would just like to strongly encourage our residents of Buncombe County to, just for the information we heard, especially around fall prevention, take some time to look around your home, even just as a child of an aging parent, even just us can go around and look around our parents' house and think of the best way for them to be protected and cared for as they age in place. And so we're just looking for those opportunities. And we hope you got a lot of information around, especially around the Council of Aging. And just as we say, Billie Breeden, she's new to it in the position with Buncombe County. She's very familiar with a lot of the agencies. So we strongly encourage you to go out to www.buncombecounty.org to get more information. And just as we heard today, she had a lot of wealth of information, especially in her new position around age-friendly coordinator. So as she said, you can email her. So we strongly encourage the residents to take this opportunity. Look around your home, look for safety, and always go to buncombecounty.org for more information around our aging population.
Yeah. All right, Billie, last chance.
One thing I wanted to bring up is that one of the initiatives of Age Friendly Buncombe County is we wanna there's a proposal to build an active aging center.
Oh, wow.
So there's a Buncombe County page about that. And there's also Engage Buncombe County. There's a web page, and you can scroll down and look at age friendly, and the public can provide input on various things related to age friendly, as well as the proposed active aging center. And thanks for having us here today.
Yeah, thanks for being here. Well, I'm going to get ready to close. And I like to say, if you ask a lot of older people, they would say aging is not friendly, but necessary. But we at Buncombe County want to let you know that we're here to support you in that journey, no matter how it looks. And we want you to be able to live and thrive in your community. Also, just a word of doing. Throw away one thing every day that you don't need. Declutter. Do you really need that newspaper from 1984? If it's not worth money, throw it away. Do you need that rug that somebody gave you from 1975 that's shag and it's not even green anymore? Throw it away. One thing a day keeps the falls away, okay? With love, compassion, and respect. We are One Buncombe, and we are Tapped In. Thank you.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Asheville. Learn more about today's topics at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.